This is an audio-visual representation of a study published in the Journal of Bone and Joint Surgery in 2021. Femoroacetabular Impingement (FAI) surgery is a procedure performed to repair the hip labrum and cartilage and correct underlying deformity of the proximal femur and/or acetabulum. However, the effect of biological sex on the outcomes of hip impingement treatment remains unclear, with recent studies reporting some discrepancy in outcomes between males and females. To find out more, a group of clinicians from the US and Canada sought to understand these biological sex-related differences in a prospective multicenter study. They analyzed 621 patients undergoing treatment for hip impingement, of which 56.7% were female. The primary outcomes analyzed were hip pain and function, as well as a series of subscales from activities of daily living to sports and recreation. The study found that a number of differences were present between males and females at presentation, including male hips having greater body mass index and larger alpha angles than female hips. Further, preoperative patient-reported outcome scores, called PROs, were lower for females. When the outcomes of FAI surgery were investigated, females had lower postoperative PROs than males. In order to isolate the role of biological sex, a multivariate analysis was performed to control for a number of confounding factors, most importantly, baseline PROs. This advanced analysis demonstrated that outcomes of FAI surgery were not different between males and females when assessed by either PROs or outcomes, including total hip arthroplasty, revision surgery, or persistent symptoms. In conclusion, this study identified that while clinical outcomes appear to be significantly different between males and females, this apparent effect is driven by the lower baseline PROs in females. After controlling for baseline differences, biological sex was not an independent predictor of clinical outcomes related to FAI surgery.